So thank you for joining us today. This is the IGPM session on PCN management. We are recording the session today just because I know there are a few people who wanted to come but couldn't make it. So we will pop the video on our YouTube channel afterwards. So just bear that in mind that you are being recorded. I hope that's okay. And if everyone can kind of stay on mute unless asking a question or called upon, just so we reduce any background noise, that would be fab. But please do put cameras on because we do like seeing people's faces and making sure that we're not sending you to sleep as well. So let me just share my screen somehow. Oh, Ali, I don't think I can share it. It's not giving me an option.
Yeah, I put it on share, multiple share.
Ali, are you able to mute people that aren't muted? Or?
No, because then I mute everybody.
Okay, so
You got it?
hopefully you can all see that. Let me know if anyone can't see it.
Yeah, we can see it.
Awesome. So we're going to run through the sort of presentation on PCN management and representation from IGPM as we go through. If you have got any questions, pop your hand up or put them in the chat, and Joe's going to help man the chat as well and come back to you where we can. I'll have to leave it like that. Okay. So hopefully most of you know who IGPM are by now. But if you don't, we were set up about just over 3 years ago now by us 4 practice managers. That's me with very different hair. You'll get used to that. It changes all the time. From across England, who all basically joined together for a number of reasons, which we'll come into in a second. But so Joe, Kay, myself, and Nicola are the directors for IGPM. And then we also have Sarah, who's with me today, who is our PCN Manager representative. So Sarah, do you want to introduce yourself?
Yep, so I've been, my name's Sarah, I'm obviously PCN representative. I work in South Gloucestershire with Robin, hence we're
in the same room.
In the same room. I've been in general practice now in healthcare for about 28 years and general practice for 21 of those. Became a PCN manager about 2.5 years ago, and hopefully got a breadth of knowledge of what general practice is about and also the PCN world.
Brilliant. So why IGPM? Why did we form? So essentially, when this sort of all started, we realized there is actually no representative body for practice or PCN managers. There are a number of different organizations that provide training and support and help to practice managers, but they aren't incredibly well known. There's no sort of professionalization of the industry either. We were overlooked for the new to partnership scheme as practice managers, but we also felt that there's a sort of lack of clarity around the role or what support is available for PCN managers as well. Obviously, when the PCN DES started, there was no provision for management at all. That then changed with the introduction of the leadership and management payments, and then even more so since with the introduction of the transformation and digital lead role in the R scheme, which I know a lot of PCN managers are funded through. But in terms of what that role is supposed to do, who is supposed to help them, we felt that there wasn't really a lot of information out there for that either. And generally, no one's sort of fighting for management in general practice or a PCN level with the stakeholders that are important. Then so much gets developed and decided and done to us, and we don't get engaged with. And we felt that this was obviously a massive oversight because we are the people that generally have to put things into place. So we wanted to make sure that we have that voice and that we have that input. And so, yeah, IGPM was born in the end of 2020. 2020. And currently we have 1,600 members, and about 130 of them have now become accredited and have joined our professional register. So that's kind of who we are. We are supported by a number of regional representatives. So Sarah here takes on a national role as the PCN lead, but if you are looking for some help more locally, we have a whole team of regional representatives across England, Wales and Northern Ireland. Hopefully you might not be able to see all the detail on that, but on our website, there is a list of regional reps and how to contact them. So that is available for you if you need some help where you are locally. And so what do we find are the 10 commandments of practice and PCN management? I mean, first of all, I think you would agree is finding the right PCN for you. Who you work with has a massive impact on your enjoyment of your job, your performance, your well-being and your overall resilience. Identifying your tribe, making and keeping good connections. And we hope that's part of what we can help with, becoming a part of the network of PCN managers across England. My favorite one, don't reinvent the wheel. I think we all know there's enough to be done around sharing best practice and not having to start everything from scratch. Getting the important stuff done and sometimes forgetting the rest. You know, we have to focus on the things that really matter. Our time is always pressured, so we want to make sure that we are focusing on what we can do and what's going to have the biggest impact, and on your skills as well. You know, making sure that your skills align to the work that you're doing. It's okay to say no. I think we're all terribly guilty probably of not doing this enough, but it is something that we need to prioritize. And especially for PCNs as well, being present in your community, you know, the whole ethos of integrated working, not just between practices as networks, is also what's going on outside of your practice and around you. Being fair and honest to your team and to patients, I think we're all quite good with that already. Plant seeds for ideas. I think you guys probably may do this sometimes, maybe even more so than practice managers do, because so much of what PCNs do is new and development and innovative. So it is how you can, you know, get ideas to flourish. And obviously we're going to say this, aren't we? Join the IGPM and get accredited. So I want to talk about accreditation. Can I just get a brief sort of hand up from everybody if anyone is already accredited? I know Sarah is. Okay, interesting. Is anyone interested in accreditation or considering going through it? Lucy, yeah. Okay, so we want to take this opportunity really to talk a bit more about how the accreditation process works. So to be eligible for accreditation, you need to have been a manager working in general practice for 2 years, but this does include PCN managers as well. You must not be in any breach of articles of our membership document. So, you know, basically don't be a criminal is the general one, which I think we're fine with most of us. You must not have any pending or active disciplinary action at the time of application, and you have to have been a paid associate of the IGPM beforehand. So, you know, what is it that happens? You get awarded the MIGPM post nominals once you've been through the process and been accredited. You have to do so demonstrate the required proficiency that's detailed in our accreditation framework. And what I want to say is this month, we are actually launching a separate PCN Manager accreditation framework. We sort of recognise that the PCN Manager role was different to the practice manager role, so not all of the domain criteria may feel appropriate and may put some people off. So from Sarah's feedback, having been accredited, we have adjusted that framework going forward. So we'll be launching that very soon. And it's almost just like filling out a job application form. Yeah. So you're basically demonstrating how you meet the criteria in each domain. So I don't know if Sarah, you want to talk about your experience of going through accreditation?
Yeah, so I started writing down and I started making my lists of looking at each domain and thinking where do I hit with that? And I have to say I did that and then I shelved it for a while. But when I got that back out, you've got to be in the right frame of mind. As Robin said, it's like filling out a job application. You've got to have the confidence to be able to say, yeah, I did that. And in my experience, once you start writing and you start remembering the projects you've been involved with and the people that you've had connections with, it flowed for me. I know that's not the case for everyone, but it suddenly made me realize all the things that I had been involved with. And again, I fell back on some of my practice management role, which is why we're looking at tweaking it and relaunching it as a PCN specific manager accreditation. But it was so satisfying to look back at all those things that I'd been involved with and to be saying, yeah, I did that. I'm actually a lot better than I think I am on a day-to-day basis. I did all of these things. So for me, it was really rewarding to go through the process. And I've got a lovely certificate on my desk as well.
So for those of you who haven't seen it, these are the 10 domains of the framework. And we haven't changed any domains like over titles basically in the PCN Managers because we do feel they're still all applicable. So, you know, qualifications and achievements, personal qualities, professional development and working with others, you know, very, very important in a PCN Manager role. Leadership, level of responsibility and accountability, strategic planning, vision and decision making, even more relevant for PCNs in setting that up. Managing and improving patient services, working with patients. And I hope, you know, I think some PCN managers look at that one and think, oh, I don't do that so much, but I think it's really important. And I think, you know, if you are doing service design or improving services, you are often getting feedback from patients, which is engagement. So that's important. Workforce, there's the whole thing around the R's roles. Many of you will also be line managing staff or contributing to organizational development planning. Financial proficiency and practice or network stability. So the financial proficiency, there's enough money that comes through with PCNs. It's hard to manage, I imagine.
Yeah, I'm managing that R's budget well.
Yeah, and contract compliance, making sure you're maximizing your income opportunities, your QI, your IIF, that kind of stuff, and network stability. Keeping the network functioning is really important. Estates and facilities management, and I think in the accreditation framework for PCN managers, you'll find that very different to the practice manager one, because obviously the responsibilities are different, and how much input you can have on facilities may vary.
Yeah.
But it's more thinking around when you are setting up services, how do you make those efficient, digital considerations, risk assessment, that kind of stuff. And also from many of you, if you were doing it back then, it's the COVID vaccine services. That's a prime example that you can use of how you've used managed estates and facilities. Working with other organizations as service providers. I think you guys might get to do that more than us practice managers with the role that you have. So I'm really looking forward to seeing some examples from that. And then the probity, legal and compliance governance, that's kind of the have you got a network agreement in place? Is it current? Have you got an appointed clinical director? That kind of stuff. So it might seem a little bit intimidating, but it's really not. And it's almost like sort of applying for the job that you're doing by showing all the things that you've done, if that kind of makes sense. We've had some amazing feedback from people who've gone through the accreditation process, and there's just a little summary of some quotes from managers that have been through it for you. Kind of following on from what Sarah has said, feeling that it shows the growth mindset, that it's very satisfying, that it's pride in knowing that you've met the standard with the experience that you've had. And again, I find this too when I wrote my own one. I at the time that I got accredited, I'd been a practice manager for about 4.5 years. And I looked at what I'd written down on paper and just thought, well, I've actually done quite a lot, and I'm quite proud of that. And it's really interesting to look back and reflect on all the things that you have done in that journey. And also how often, working in practices and networks changes as well,
Yeah.
and how adaptable you have to be. So obviously our question is, what are you waiting for? Probably for us to launch the PCN Manager framework, which should be coming out later this month. So there will be a bit of social media activity and promotion around that. So do keep an eye out for it. And we also like to add in here one of our favourite quotes from Mani Hussain, is the Director of Primary and Community Care at CQC. And he basically says, practice managers and other non-clinical leaders play a pivotal role in ensuring GP practices deliver good or outstanding patient services. And we hear this time and time again from a lot of our supporters in the BMA, RCGP, NHSE about how important good practice management and PCN management is. So that's why we're trying to invest in this as much as possible. So what else do you get for your IGPM membership? You don't just get access to become accredited. We try to enable you to network and obtain peer support. And I hope if any of you are associate members already, you're in our WhatsApp groups. So these are members only WhatsApp groups that we have on various topics. So these are just a sample of some that we have: wellbeing, CQC, finance. There is a specific PCN Managers WhatsApp group as well, which is great for sharing ideas, innovations.
Or asking questions.
Yeah, or having a general moan as well.
What are you doing about X? And we'll answer those. We'll support you.
Yeah, absolutely. But also some of the other topics will cross over for you as well. If you are a line manager, that HR group will be useful. If you want to kind of understand the wider impact of finances, or you want to talk about PCN finances and how they interlink with practices, the finance group is there. And there is an accreditation group as well. So if you are going through it and you want some support on how do I evidence this domain, or what have people written here, that's a good source of support for you. What else do? We make statements on your behalf. So here's two that we've done recently. We wrote a statement in response to the autumn 23 budget statement, primarily kind of focusing on the potential increase to the national living wage, which is a big concern if it's not funded for practices and for PCNs. We had that whole issue this year with the AFC uplift and the impact that's had for PCN managers trying to manage that budget and the expectations of staff. I'm sure many of you have lost sleep over trying to deal with that. I know you did.
Yeah.
We also wrote a statement on our viewpoint for the new vaccination strategy. Again, something that PCNs have been integral for in the last few years because of COVID. You know, if that gets outsourced to some other private enterprise, you know, what's the impact that's going to have on practices? Is it good for patients? So we do try to speak to the people and the powers that be to talk about how, you know, general practice and PCNs are affected by changes at government level, NHS England level. So that's part of our role. We also do campaign for you as well. I don't know if any of you have seen our If I Die, It'll Be Your Fault campaign, which was the first one we did back in 2021, which got close to 400,000 views on YouTube, I believe, and was shared quite widely. Kay, bless her, ended up on BBC Breakfast about it. I think she wasn't prepared for that, but it was great. We are working on one at the moment, which is focusing around the role of reception in care navigation as well. So that should be out in the next month or so. And we also, you know, take ideas from our membership. So if there's anything else that you feel we could be campaigning on, just let us know, because we are really interested to hear from everyone. We also, you know, talk to the important people. So these are a couple of organisations that we have good links with. You know, we meet regularly with Manny from CQC. We are linked in with GPC about contract negotiations, which is going to include the PCN contract. So even more reason for us to hear from our members on how that could be improved. I think, you know, the big question for you guys probably at the moment is it going to be continued?
Yeah. Do we have jobs?
Do you have jobs? Absolutely. I think we have been told that, you know, we shouldn't stop recruitment to ours, that we should assume that it's going to continue. We're all expecting this next year to just be a stepping stone almost before the potential change of government, a potential whole new longer term contract. So we're kind of expecting more of the same, but you know, more of the same doesn't include inflationary uplifts. It doesn't include the, you know, how do we actually manage the AFC versus non-AFC issue about the R's roles. So we are, you know, fighting your corner for that too. And then finally, I'm just going to keep this really brief because I would love to open the floor for questions. You know, our promise is that our leadership majority will always be people working in practice management. So the board is, and the regional reps are all working practice managers or PCN managers. We are not for profit. So your membership fees do not just land in our pockets. They are there and invested in, you know, more campaigning support and education that we can provide. And the views of our members are always the most important part of our constitution. So we are always open to hearing what everyone has to say and how we can help. So on that note, I'm going to open up the floor to you guys and stop screen sharing. And just ask you really if there's, you know, any barriers that you've had to membership or accreditation, any questions that you have for us, or anything that you want to see us doing that you feel that we're not currently. So over to you guys. And it's all quiet in the chat. Don't be shy.
I think
I've got my hand up. I was waiting to.
All right, Emma, go ahead.
Hi. Hi. Yeah, thank you for that. I have a couple of questions, if I may. You said something about launching the PCN Manager framework later on, but your colleague has already, Sarah, has already been accredited. So is it alive now?
No,
so I'm a bit confused about what, you know, because there's things there now about what this is what we want for the PCN Managers accreditation. So what's being launched? Is it just like advertising it, or is it changing?
I think when I went through, I did the practice management accreditation, the sort of standard one, because I had been a practice manager. I could fall back on my previous role, and I said to the team, it's like, actually, if I was new to PCN management, having never worked in general practice, I'd have really struggled with that. And that's where the feedback came to do something that's a bit more tailored towards PCN managers. Yeah,
and I think Sarah's not the only PCN manager that we've had accredited, but I think the ones that have gone through it have either had to certain elements, certain criteria, they just had to say, this is not applicable to my role. And we can't, you know, mark you down based on that, because if it's not applicable, it's not applicable. If you can demonstrate evidence everywhere else, then that's fine. But then the feedback was this could be more specific. And so what we have done is then created a new version specific to PCN managers. So you could, if you wanted to, still just do the standard framework, but there will be more of that not applicable, and we're potentially missing some stuff that is specific to you. So that's why we revamped it and launched a separate one. Does that make sense?
It does make sense, and that was one of my second points. So there is a PCN accreditation framework. Is that changing?
Sorry, say that again. There's a PCN
So
accreditation.
there is a framework, accreditation framework aimed at PCN managers. Is that changing?
From what, from us?
What I'm thinking is, right, I've got something that I was about to sort of start filling in and everything, and then you said you're launching something later on, and I'm thinking, are people going to start something and then go, oh no, we have to change it onto that? That's what I'm trying to get the logistics of it.
I see what you mean. No, so when we launch the PCN Manager specific, we'll be sticking to that one, and that has come out
Right.
based on the feedback from people who've tried to do the standard one and gone, there's lots of it that just doesn't apply. So
And
we
can see that one now, can't we?
Yeah, so yeah, if you go on our website under accreditation, just the standard accreditation framework is what everyone's been applying to up till now. So yeah, it will be more specific to PCN management from that. If you have already done that one, we're not making you redo anything. So if you become accredited, you can keep those post nominals and you've met the same criteria. There won't be any additional work to do.
And they're not massively different. It's just a slightly different slant to reflect the fact that you don't generally manage a building when you're a PCN manager. So how do you hit that criteria? And so it's asking the questions in a slightly different way.
Yeah, no, and that was going to be my other point. Really, was that PCN management. I've been a practice manager many years. I've been a PCN manager for quite a few years as well now. They're very different. They're sort of quite different skill sets. So like a PCN manager will often have to manage a remote workforce, like a predominantly remote workforce, whereas a practice manager, sees people as they wander through more typically, So I'm just thinking they are different skill sets, aren't they, and stuff, and examples.
Yeah, so that's why they've been tweaked. I mean, like I said, with the sort of the patient engagement side of it, like you don't necessarily have a PPG, do you, as a PCN manager? So instead, it's more, we've created this new PCN wide service and we've had some patient engagement to develop it. That's going to meet that criteria more than a practice manager might just say, well, I run my PPG and I go to the meetings and I do the surveys and that kind of thing. So it's just a bit more nuanced.
Robin, there's another chat as well. Another question in the chat says, I've been a practice manager, business manager in primary care, and I'm now currently a PCN manager. Should I wait for the PCN manager accreditation framework, or can I do the current one?
I think it's up to you. If you have a look at the current practice manager one, I mean, we haven't called it the practice manager framework. We've just called it the accreditation because it can also be adapted for deputy practice managers, ops managers as well. If you feel you meet all of the criteria, you can use whichever one you feel is most appropriate. And it's not going to be a case of, if you do the PCN manager one, you'll get your MIGPM brackets PCN. It will still just be MIGPM because you're still working to that same standard. They're interchangeable. So if you then sort of are a PCN manager and go become a practice manager, those nominals travel with you.
That's the next thing. It says, I looked at doing the accreditation as a practice manager, so would be interested in doing it as a PCN manager. However, will any PCN manager accreditation be seen as different to the practice manager one as relevant and important to primary care? So yeah, it's just trying to sort of, I think it's people going, do I go the practice manager one? Do I do the PCN one? But actually they're the same. They're just
one isn't easier than the other or anything like that. It's still the same 10 criteria. And the point of those domains really is that they are transferable between the roles. You're doing the same things, but just in a slightly different context.
Yeah, exactly. They're both as important, and they both take as much time and effort to complete, but it's not massively onerous in any way, shape or form, is it? So
yeah. I see there's another question about joining the WhatsApp groups. So the WhatsApp groups are members only. So if you are a member, you can email us. I'll just put the email address in the chat, or if you're in our closed Facebook group on Facebook, the links are all in there as well. But if you want to email us, then they will also send you them.
Yeah.
Oh, there's some water.
I can't see how to put my hand up. I'm sorry. I'm not.
Sorry, Bobby. Go ahead.
That's all right. I was trying to work it out, and I've lost the plot on Zoom now. I've gone totally Teams blind. I wondered, and maybe it's something to talk about offline, but I've been a PCN manager for 4 years since the beginning, and I have taken on a new role this year. So I'm in Buckinghamshire, which is part of Bob ICB, and we formed the Buckinghamshire GP Provider Alliance, which is the alliance of the practices, the networks, and the federations to act as a system partner to the ICB. So we are sitting at the table with the, the trust and the mental health trust and community providers and the local authority to represent the general practice provider perspective, and kind of campaign on a local place level for stuff. So examples of that might be where we challenged all the IIF indicators and received a recognition payment for all the practices, or development of locally commissioned services for practices, and so on and so forth. I've kind of watched you guys with an eye, but I don't really fit into what you're talking about. However, I think what my role is really relevant to you, because we're also in conversation with Claire Fuller and NHSE about the future of kind of general practice leadership within the ICB. And I'm the management person of that. So maybe it's another conversation separately, and I can share with you.
I've got an answer for you.
But I would probably look to do the accreditation on a PCN manager basis, although I technically am no longer employed by a PCN, but I'm confident I can fill in the accreditation. But I'm just interested in kind of, as we move forward, the function of management within the kind of system in place, because it'll have to, like you said earlier, the managers are kind of pivotal in anything actually happening. So I'm interested in kind of how I might slot into.
We've got you covered, Bobby. So we also have affiliate membership.
Right.
So affiliate membership is the same price as associate membership, and it gives you, so it's basically those people working as managers or in support of managers in arm's length organizations. So that could be GP federations, LMCs, ICBs, but who have a specific kind of role in supporting management in general practice. And then if you can still apply for accreditation as an affiliate if you meet the criteria, and then if you are accredited, you still get to have IGPM as well as your affiliate membership. So if you go on our website, there's information on the membership page about how affiliates work. So have a look there, because I think that will kind of answer your question.
Okay, great.
All right. There was a question as well about the fee. So if your associate membership is £50 a year plus VAT, the cost of accreditation is £280 plus VAT, but it's a one-off fee. Once accredited, though, your annual membership fee is £85 plus VAT to retain the MIGPM.
And I would add to that, I think it's important to go to your PCN board and say, could you fund this for me? I did it with my PCN board, and I know there's PCNs around the country where they're looking at membership as a whole and funding that. I think it's really important, particularly as a PCN manager, where we're not perhaps as clear on where our future direction is going. For me, it's really important to have that line in the sand and say, yes, I've got this qualification now. So if I do go either back into general practice, an individual practice, or if I go look at ICBs or I look elsewhere, that I've got that standard. It was quite important for me to have that, even though I'm not planning on going anywhere. But for me, it was just that recognition that, I'm up there with all the other practice managers in my PCN, and I'm an equal. And it helps, I think, when you're looking at negotiating pay. I think the fact that a digital and transformation lead is an 8A role is slightly absurd in terms of comparison with general practice pay, but that shows what level the powers that be are sort of placing us at. If they're thinking that we're worth 8A money, then it is important to have a qualification and that standard.
And it just, to me, it also leads into the further professionalization of what we do. We have a professional register, we have a code of conduct to abide by, and a regulatory framework as well, like every other sort of healthcare profession that's out there. And I think that helps to give us more of that standing in those communities and those conversations. Whereas, we practice managers were excluded from the new to partnership scheme, we were told, because we're not a profession. And, think of one sentence to annoy thousands of managers working across the country. There it is, and that is a sort of viewpoint that we're trying really hard to change, and this accreditation framework is part of that. It has been recognised by NHS England. They have promoted it as part of their practice and PCN management workforce development. CQC are really keen on practice and PCN managers having it. They've talked about potentially having their inspectors who are managers to also go through it, because then they understand, you know, the role of the practice manager and the PCN manager. So it is gaining traction outside of GPs and PCNs as well. Emma, Ray, you have another question?
Yes, thank you. Something that I'm just saying this because I think it might, other people might be thinking, something that put me off for ages was going, well, you're asking for like evidence in all your areas when you're filling it in, and I'm going, well, what evidence? You know, I can't share confidential documents. And so I think I understand you're looking for just a written evidence, as in, this is what I've done, I did this, I did that. And so I think for ages I was going, well, what evidence can I share? And so I just thought, I just wanted to clarify that is what you're looking for, and just in case other people are thinking those things as well.
We would definitely recommend, if you've got questions, join that accreditation WhatsApp group. And you can also contact Sarah or your regional rep or the board if you've got queries. In some areas where we've had funding by the ICB or LMC or training hubs, we've actually put on coaching sessions. And we do it as a sort of 10-week program, you know, 1 session per domain. Which have been really, really successful. Joe's run them in West Sussex. We're just starting to do them here in BNSSG. In Manchester, they're really popular as well. So there are opportunities to always ask questions, but the amount of evidence will also vary from domain to domain. So like in workforce, when one of them is the line management of staff, you just have to say, I line manage staff. Fantastic. If you supply a copy of your organizational chart, even better. But then it will say, you know, quality improvement initiatives. Tell us about something that you've done. I don't need to see all of the background documentation, the costings or anything. You need to say, you know, we implemented this new system. This is how I went about it. The one thing I would say as guidance is make sure that you highlight your role more than anything else. I love to know what your team has done, but that's not going to get you accredited. I need to know what you did and what your process was. And I think where we've had some of the feedback we've gone back to people who haven't met the standard is because they spent too much talking about we and not I. This is your accreditation, you know, it's your application form. If you were using this as a job application form, you wouldn't tell the people interviewing you what your pharmacist did. You want to tell them what you did or how you enabled that pharmacist. So yeah, think of it that way. But there's so much support available if you have any questions around that process, because we want people to, we know you're doing amazing work. And for me, honestly, there is nothing more wonderful than seeing some of the stuff that comes through and what's going on out there. It is absolutely fantastic, and it makes me so proud to be part of this community, because people don't realize we change lives. You know, we enable every piece of good practice that happens, every bit of clinical innovation, every good patient outcome. We are there enabling that, and it's really, really important to have as many of us as possible on that list of professionals.
Yeah. I think it was going back to what Robin said, you know, you might not have run that project. You know, a lot of practice managers will say to me, oh, but I was part of that cog. I didn't do it all. But that's okay. But just explain the role that you did within that. So, you know, as a practice, we did this, and this is what my role was. I was mentoring them, or I was overseeing it, or I was meeting them regularly. And, you know, so it's just about what your role was within those projects is really important. And there's bullet points, which gives you really sort of good clarification about what sort of information we need. So if as long as you go through the application and you just make sure that you write some written evidence at each bullet point, it will make it much easier for us to go through and collect the evidence as well. So, and you can resubmit, can't you, Robin? So if the worst comes to the worst and there's a couple of domains you don't meet the criteria at, you'll get good feedback for that, and then you can just resubmit that within those 2 domains or whatever it might be. So
yeah. Emma Prince has just said, if we have experience as both PM and PCN manager, can we use examples from both roles? Absolutely.
Yeah.
Any example that you have that meets the domain criteria, chuck it in there. It's absolutely fine. You use both, didn't you, in yours?
Yeah.
So yeah, that's fine.
Yeah. Definitely crucial to join the WhatsApp group. That will give you lots of information.
Definitely.
Lots of questions. So.
Awesome. Any other questions? Brilliant. Well, thank you so much for giving us your time and your lunchtime today. I hope you're going to go and get some time away from your screens now. But we'll record this session, obviously, and we'll put it up on our YouTube page for anyone that's missed it. But any questions, info@igpm.org.uk is the email address, or visit our website. So thank you very much, guys. Thanks for your time.
Thank you very much. Good luck. Bye.